All right, step number one on the Young stretch is to get the patient laid down with their hands under the back. You want to make sure that the wrist is flat and not kind of flexed. So flat is going to give you a clear picture of which shoulder's higher. If the throwing shoulder is higher, I mean, sometimes it can be really high, it can be way up here. That shows that the capsule's really tight. The humeral retroversion has some play in this, but only about 7 or 8 degrees. Like this would be representative of a very tight posterior superior capsule. So first thing you want him to do is relax. Do you feel this? Do you feel it stretch at all here? No. He doesn't feel it. So I know that we can put some pressure on it. So I'm gonna block his arm. I'm gonna basically internally rotate it. And then I'm going to elicit the stretch by pressing down. This is going to retract the scapula. Let me know when you feel it. Just relax. Feel that stretch at all?
Not a ton, no.
And just relax. It's like you're guarded a little bit. So just relax. I'm not going to hurt you. Let me know when you feel it stretch a little bit.
Right there.
Okay. So when I get to a stretch, you know, a little bit, we're just going to hang out there. My man here is a little bit guarded on this stretch. So for someone that's very broad or large, there's a modification to this stretch. Hands under the back. So left hand, you want to slide along the scapula. And when you get the pad of your hand on the inferior border of the scapula, you're gonna leave it there. That's gonna basically posteriorly tilt the scapula, which is already gonna elicit a stretch. And it's also going to retract the scapula in the perfect plane you want it, which is basically a medial inferior glide. From there, I'm going to take my forearm and I'm going to posteriorly tilt the scapula while retracting. Let me know when you feel a stretch.
Good.
All right, I'm just going to hang out there for a minute. All right, now if I'm going to have him do this at home, what I'm going to do is grab a weight, which I'll go get, and I'm going to put it right here. And that's going to act as a self-stretch. So put the towel there so this dumbbell doesn't dig into his skin. But I'm going to put a 20-pounder there because my man here is pretty mobile. He's very pliable, which is great. That's what you want. But this is going to elicit the stretch. No fidgeting, 5-minute hold, twice a day is typically what I prescribe. Now, if we wanted to modify it even more, we're gonna have you bend both your legs, both your knees. Perfect. And then what he could do is rotate both legs to the side of the stretch, and that will increase it. Because it basically internally, the body rolls onto the arm, internally rotates the shoulder a little bit more so we can elicit a little bit more of a stretch. Perfect.